A woman's life is lived in a million ways, and each phase comes with its turbulent times. Pregnancy and postpartum often come with their own issues. Obstetric fistula occurs when a mother has a prolonged obstructed labor but doesn't have access to emergency medical care, such as a C-section. This medical condition causes the incontinence of urine, feces, or both. It is a childbirth injury that often destroys a woman's life. Obstetric fistula is one of each woman's fears.
Access Bank is passionate about women. Through our W initiative, we've championed causes that ensures that women thrive in whatever endeavor they find themselves, be it life, education, business, and so on.
National Obstetric Fistula Tax Team put up by the government of Ghana through the Ministry of Health, the Ghana Health Service, with support from the UNFPA. The primary task of the team was to oversee and supervise all fistula-related activities in the country. And we established that every year in Ghana we have about 1,300 new cases of obstetric fistula occurring. We saw as a bottleneck in that strategic document, this is a costed strategic plan, funding was the challenge. So when in 2018,
Castings pledged 20 surgeries, and we said, why don't we extend it to other people? Create the awareness with the suppliers. So we went to the Thanksgiving with sponsorship for 43 patients. Somebody from Mercy Clinic came and told them how the surgery is done and what sponsoring one patient involved.
Access Bank was one of the first organizations which answered the call and pledged to support 100 surgical repairs at the Fistula Center at the Women's Hospital in Mankesim, where the Fistula Center resides.
Corporate social responsibility, CSR, is an integral part of Access Bank's sustainability strategy and underpins most of our business decisions. At Access Bank, corporate social responsibility cuts across almost everything we do and everyone we deal with, from employees to suppliers, and from customers to the community. CSR is a continuing commitment for us. For the past 3 years, one of our major CSR focus has been the Fist Against Fistula project.
We received a massive support with over 1,300 participants joining us to have a walk, the 10 for 10 kilometer walk, to raise awareness, funds, and of course, educate the general public of the menace fistula.
Accra, in Kumasi, in Ho, in Techiman, in Wa, in Bogatanga. First of all, to educate many people in the community about the menace and also preventive ways and steps that they needed to take.
We strive to behave ethically and contribute to economic development while improving the quality of life of our workforce, their families, as well as that of the local community and society at large. We hope this will contribute in achieving the United Nations global goal of eradicating fistula by 2030. We're happy to have relieved close to 200 women from this menace.
After being plagued by the silent emotional killer, obstetric fistula makes living unbearable and worthless for women.
First, today in ho. Inti yadi mito ahoma nka em yadi miko oponso. Na doctor say won to be family ko dunkwa. Ti yadi miko dunkwa no. Ade chie na chese awo no me ana me wo ye. Mpato na chira de no. E de yadi miko theater. Ti theater na chi na me ba ye no. Na afi me hu se nsuo ne start egu me. Ti me tra hospital for 3 weeks na enko. Na doctor mama report to say me fan ko ji. Na me de ko ji mininya na me ne me maame na eko nti mini ne ko ye no ho so ye nya ya nsa ne sa ba ye sa kire ye baabi ye fle ho agro so na ho so sa no so ko ho 2 times me nya ya sa pa cho kire ne ye sa kwa agogo ho so sa ye nya ya sa na maame di free na kire bi se de biniska na chese me trase se de na tuska se muti me so maame nso owo me kwa me maame nuam na me no mo ho nti ne mpa ya na yesese menya hospital fofora omode me beko dwuma no na be ye de nso me kwa sori kra da mani nye efiri se obako obesori na ho afo untumi nya hwe fom de seja me kwa me nko amafom nti ene efo kra me befi a metumi aye de me ye na so mum de na metumi nko ne papa manko di nsini bia ho nyame na me hwe no se obebu am na me ho menya yaresa
me ba mo no eye me ho ba mo si me nse nkrofo be dom si o mo do ye pa ya ntohwe ya ye bibia de o mo kokro ye kompo a enye beble mo kokro ye saada aha na mbe hu sa kokro ne aha mo uye oba uye sa yale ni yare we bo wa enko disi ho enko bebia enko mpaibo wo da fa hospital no me yamo.
Access Bank adopts a holistic approach to eliminate obstetric fistula. It begins with psychological assistance in the form of counseling for patients, free surgeries, and financial support to aid patients in their complete recovery. Mercy Women's Clinic is known for being compassionate in handling obstetric fistula.
At the fistula, we take care of women who have gone through labor, delivery, and unfortunately have ended up developing obstetric fistula. And these women, some of them leak of urine, some leak of feces, and some leak of both urine and feces. Most of them come in miserable. They come in smelling of urine, and some of them, the husbands will divorce them because of the stench.
Over the past 3 years or so, Access Bank has helped us enormously to carry out surgical repairs for women who are living with obstetric fistula. In the first year of the program, we repaired about 100 obstetric fistula cases at no cost to the patients. So all the cost that was associated with the surgery was borne by Access Bank, including transporting the patients from their various destinations to the hospital, carrying out laboratory investigations at the hospital, and of course, the surgery itself.
The physical fight against fistula begins in the theatre. The hole has to be sealed. Obstetric fistula is, however, preventable. Cesarean sections are undertaken to repair the holes and save both mother and baby's lives.
So we separate both the bladder and then the private part, and then we close them separately. So that's the principle behind the surgery. And then after that, in order for them to heal very well, we keep a catheter in for about 14 days to 3 weeks. So during that time, it allows for the healing process to take place so that where we have sutured, it will take time to heal. And then after that, we go ahead and then we take out the catheter. So most often than not, the surgery is successful.
And at the end, when the surgery is done, depending on the severity of your case, you'll be here for 2 weeks, you'll be here for 3 weeks, or for 5 days. The joy the patient gets at the end makes us, when we are even tired, we try to come to support them because it's a joy to see a fistula patient cured. We are so happy.
Due to the stigma, a lot of patients are reached in various ways for the surgery.
We do a lot of outreaches. We go to the radio station, when we go on outreach with the child welfare clinic, when we give antenatal care, and when we have World Day, celebrating different World Days, we talk about fistula as well. So a lot of people we have here now, some of them were gotten through the outreach, and even Access Bank got us some patients. They also got us some patients to care for, and some through the sister hospitals, they get us some of the patients, and some also through people who have come here, gotten cured, also go and they bring us patients. We take care of the patient. We measure their urine every morning. We take whatever fluid they take in. We do intake and output. We do that for them. Then psychologically, we handle them. We give them care because a lot of them would have gone through a lot, the stigma. So we try our best always to be with them, give them the necessary nursing care they need. We give them the support.
It is imperative that we prevent the occurrence of obstetric fistula through education on sexual and reproductive health, regular antenatal clinic attendance by those who are pregnant, those who are about to deliver, that they seek skilled services, also through the prevention of early teenage pregnancies, child marriages, ending or preventing sexual and gender-based violence and other harmful practices.
We are proud to be associated with a gallant team.
The team that carries out the repair, mostly we do it on voluntary basis. And I must congratulate and then thank every member of the team for the hard work that they have put in for the past decade or so.
Access Bank, Yamin Shiramu Kasi, Yansa or Dema or Solomon, or more Mubima or Moduman Kosu, the Bia or Minister, no many Bia Bia Bansoa, when Ayalisaki,
Access Bank, it has commercial. Watching that, with a Tom, it has
Access Bank, so my dark Banam, Mauna Yirami, Nemia Donna Iji, Mashiago.
Access Bank is our savior. On behalf of the whole hospital, Mercy Women Calais Hospital, we'd like to say thank you so much to Access Bank for their support. Since they came in to help us, we've been able to take care of a lot of fistula patients and they are happy.
We thank Access Bank for their generosity and goodwill in supporting the repairs of over 100 women with obstetric fistula. Through this initiative, these women have had their dignities restored again and they will forever be thankful.
We want to congratulate Access Bank. May this gesture, as you have involved your staff, be a blessing for the bank and each person there. And may everybody else who sees you try to emulate what Access Bank has done. For me, it is not just Access Bank doing this for me. Access Bank Education Station which have a very strong bond. They have shown that they care.
I want to say a very big thank you to Access Bank on behalf of the chair of the task force, Professor Lasse. I know he's full of gratitude to Access Bank. The entire Fistula task force is so appreciative of the support from Access Bank. We do recognize that funding is our major bottleneck, and so we cannot let the example of Access Bank go without expressing our gratitude to this bank for all the help they have given to nearly 160 fistula patients from the inception of Fist Against Fistula up to date. Thank you very much, Access Bank.
Join us to prevent obstetric fistula and support women and girls living with the condition to get repaired and for them to live wholesome lives again.
Access Bank will continue to serve you. Women with obstetric fistula are no different from you. Embrace them with love. This campaign is proudly initiated by Access Bank with the support of CASENS, UNFPA, Mercy Women's Hospital, and the National Fistula Task Force and the Ghana Health Service.